Good morning to you, Dr. K. How are you, sir?
Oh, I'm doing really good, Jack. Good morning.
Good, good, good. All right, you took a day off, which we allowed you to do just very, very sparingly. But what has happened this week since Monday, last time we talked in terms of the vaccines and the COVID situation?
Well, one of the biggest things is, and I think this has happened before Monday, but I found out that Big Ass Fans, which is a big manufacturer in Lexington, is actually making a fan which has been tested and found to be very efficient at killing the coronavirus. It incorporates UV light, it circulates air, and this is the type of gadgets and utilities that we need to start putting into businesses to get them to open up safely. So now we even have a Lexington manufacturer that can do this. And I've been advocating for a long time that we need to recognize that this virus is aerosolized, get better clean air, get air with more air exchanges and sanitized air. And this is a Kentucky company that can do it. So I think we should get the state together with Kentucky companies to get our retail establishments, restaurants, etc., to be able to open up safer. And I think that that would be a good idea. Now, people may say, well, the pandemic's about gone. Well, it doesn't matter. You're going to have flu season. You're going to have all sorts of other respiratory pathogens that we're going to be exposed to, that this type of system would help. And I'm telling you, Jack, if you think this is going to be the last pandemic that we're going to be up against, I think you're living in a little magical world, because these viruses are out in nature, they're mutating, we're infringing upon their environment, and they are spreading. We've had MERS, we've had SARS, we've had Ebola, and now we've had, of course, the coronavirus. We're going to get another one, and so we need to get prepared. And so this, I think, would be a really good idea to do.
I think so too. That's very exciting. Just FYI, I got my first of two vaccines yesterday. Went through the university at Kroger Field, the University of Kentucky's place over there, and I have never been so impressed. They're running them through over there with incredible speed, and it's absolutely no hassle for those who haven't gotten theirs yet. Mine was the Pfizer, which means in a couple, 3 weeks, I've got to go back for a second one, which is no problem if it's going to be that easy every time. Now, I went at 140, and I may have avoided maybe the lunch run, I don't know, but it was just amazingly fast.
Well, yes, and I can tell you that they're giving appointments. My mother got her vaccine through University of Kentucky. She was 91, so although she registered online, she was rapidly called and got in, being as elderly as she is, and she's actually semi-homebound. And so all of that, I think, is very good. Yes, University of Kentucky has their act together. A lot of our facilities have done a very good job. The major problem that we had early on, as you know, is just availability of the vaccine. And I think at some point we will outstrip demand. And at that point, we're going to have to start really encouraging people to get vaccinated. There are still some areas in our state where there's a lot of vaccine hesitancy. This even includes healthcare workers. People need to realize that they have been tracking complications with this vaccine now for 6 months. So they've got a good track record of complications. And all of these vaccines that we have out now, whether it's the Pfizer, the Moderna, or the Johnson & Johnson, work by a similar mechanism. They will eventually end up to getting mRNA in the cell, which then makes the spike protein. Johnson & Johnson does have an extra step. It goes DNA to mRNA. But nevertheless, they're all similar in how they act. So you would expect the data from all of them to relate to one another, that the complications are very low at this point. Can they occur? Yes, but much less common than getting a complication from COVID-19, even if you're in the younger category. So I'm telling you, Jack, people need to go out there and get vaccinated.
Amen. I'm on your side. I believe you're absolutely right. Now, what about these? What do they call them? The strains, the variants. Yeah. Are we feeling confident that the vaccines that we have are going to cover those?
Well, the UK variant, which new data shows it may be up to 70% more infectious and 30 to 70% more lethal, the UK variant, the vaccines will handle nicely. It should kill it dead, all of them. it's not mutated enough that the vaccines do not cover it. The other variants, there are some concern, but in the laboratory, at least with the Moderna and the Pfizer vaccines, they feel that it will have efficacy in helping to prevent hospitalizations and deaths. Now, I should note that that's with getting the second dose, because apparently with those two vaccines, the virus can tend to avoid your immunity, and they're 3 to 6-fold less effective. However, if you look at the dosage, you have coverage of the original variant with one vaccine. The second vaccine gives you 10 times the immunity. So if you get 10 times the immunity, you decrease it by 6-fold, you're still covered. So that is a good thing. Now, the Johnson & Johnson vaccine is even better because it was actually tested in South Africa. And in that country, that vaccine has over a 50% efficacy rate, and they had approximately 94% of their COVID cases having the South African variant. And after 1 month, there was no reported deaths or hospitalizations. Could you still get sick with the South African variant with the Johnson & Johnson vaccine? The answer is yes, but it looks like it's going to prevent you from getting very severe disease, and that's good. So the other vaccines are tested in the lab, which will probably work, but I'd much rather have the one tested in the field. And of course, people are saying, well, the Johnson & Johnson vaccine isn't as effective as the Moderna or the Pfizer. I hear that a lot. Well, that's what the data shows on the surface. But remember, this virus has been mutating. It's becoming more and more aggressive as months have gone on. So the Johnson & Johnson vaccine was tested against much more difficult viruses and strains. So the fact that it's less effective may be just something of the timing of when it was tested rather than truly being less effective. So Johnson & Johnson single dose, that is a very, very good option. If you have that, get it. If you can get the other vaccines, those are good too. I've started, and of course I got another one. I got the Moderna, but that's good. So we need to keep people getting vaccinated. Both Jack and I have been vaccinated, so we do what we say.
And Dr. Kavanagh, let's go back to these texts. We got a bunch of them for you. This person says, like me, says I got the Pfizer vaccine yesterday. How long before I have protection? Number one. Number two, how long after the second shot before I am fully immunized?
Most of the resources I'm reading is stating about 2 weeks after the initial injection. And of course, there's an argument over whether one shot will do or not. And that's mainly with our initial strain. And now we're worried about other strains. So I would not assume you have protection after the first shot, would get the second shot. And then 2 weeks after that is when you should assume that you have enough protection in order to maybe avoid some of the disease of COVID-19. And I'm saying that because of the strains. So just because you get the vaccination, right now guidance is still wear a mask, social distance, but hopefully you'll be protected from hospitalizations, deaths, and bad sequelae from this virus.
All right, here's another question. Doesn't the virus need to be exposed to the UV for an extended period of time, not just to pass over the UV light?
It depends upon the strength of the UV light. So if it's the sun, it's a couple minutes. But if it's a UV light machine or a device which is placed on the ceiling, that's designed to zap the virus as the air passes through it. So you have a more intense UV light, and of course it's shielded and directed in a fashion that it doesn't affect the people down in the room. That's one of the reasons why it's up in the ceiling.
Here's a question. I'm not exactly sure what they mean. Ask the doctor if these COVID, it looks like PTS is what it says. Not sure what that is short for. If these COVID PTS are being tested for tuberculosis, as there was an outbreak in the 1980s.
I'm not sure what that means. I'm stumped at that one. I'm sorry. Too early in the morning and too old to decipher.
And me as well.
Yeah.
Here's another one that I think it's the same person has brought this up before. Mike says, do you agree that if a person has a car wreck that actually kills the person and then tests positive for COVID afterwards, should not be considered a COVID death? That's misleading. Do you agree with that?
I agree with that, yes, unless the person had a heart attack or stroke as cause of the car wreck. So there's always exceptions, and COVID affects every organ of the body. It doesn't just affect the lungs. That's something people need to remember.
Do you think that there are a lot of COVID deaths that are being labeled COVID death that shouldn't be? Because I know a lot of people think that.
No, I think it's the opposite. If you look at the excess death data, we may be underestimating the amount of deaths we're having by as much as 20%. COVID is tough. It affects every organ of the body. People have said, well, if you come in and die of a heart attack, that's not COVID. Well, if you had a positive COVID test, it causes hypercoagulability of your blood. It infects the heart, causes a myocarditis, could well be a COVID death.
All right, the text that we wondered about asked the doctor if these COVID patients are being tested for tuberculosis as well, I guess, while they're being treated for COVID. Do you know that?
I don't know that for sure because I'm not in the hospital setting at this point, but I do feel that people are routinely screened for tuberculosis. That's something that would actually have a positive test even after you recover from tuberculosis. It is very, very unlikely that what we're seeing are outbreaks of tuberculosis. That would be picked up by health department epidemiologists because tuberculosis leaves a footprint for years with the person once they get it.
Here's another text from our Auto Tech Service text line. Will we have to get this vaccine again next year like the flu shot?
Well, probably. The short answer is yes. The long answer is that would be optimistic because they're coming out with a booster, so you may have to get it again later this year. That's the unfortunate news on these vaccines. This virus is mutating, and we need to slow down its mutation. That means slow down its transmission.
Okay. We've got just a couple of minutes left, and I know you got a lot of material to cover there. You go ahead.
Well, I think it's very important that we realize that we need to get vaccinated, both for ourselves, but for other people. And the Biden administration at this point has really revved up production of the vaccines. He expects to have enough doses available for everybody by the end of May. And that is really good. But what I'm concerned about is that we don't have vaccinations, because vaccines don't do any good. It's vaccinations is what we need to get. And people are going to, I think, get a little bit scared that the second dose is a little bit worse than the first as far as symptoms. You need to expect to take some time off of work on that second dose. It can knock you down for a bit, cause you to get fatigue, headaches, and chills. Not in everybody, but in maybe a third of the people. So you really need to plan for that. But on the other hand, it's much better than getting COVID. This virus probably isn't going to go away because it's endemic in our animals. And we do have a large segment of our population that probably won't get the vaccine. I mean, I hate to say that, but a lot of people are afraid of getting this vaccine. And at this point, they shouldn't be. We have a lot of good safety data. They constantly track safety data. And when you get that vaccine, register for VSafe. That's a CDC program. You can Google VSafe. And when you do that on your smartphone, you can get an app and you will be sent a text message daily for a week and then weekly for 6 weeks and at 3, 6, and 9 months to track how you're doing with this vaccine. And that also gives the CDC ample data on tracking safety. So it is something I really encourage people to do, both to get the VSafe and to get the vaccine.
And the fact that Texas is now opening up, and so is Mississippi, I believe, and Alabama is going to be next, and Florida. I'm very concerned. I feel strongly that this is too early.
Well, I do too, and I've kind of tried to put that out of my mind because it's so crazy and could be potentially so harmful. They may get away with it, but it's a real race between really our non-understanding of epidemiology and the dangers of this disease versus how fast we can get the vaccines out. Because we're no better than what we were back in late October as far as cases go. Cases are too high to be opening up like that.
I agree. Have a great weekend. Thank you. Dr. Kevin Kavanagh.
Thank you, sir.